one.
Hello, Pierre. It's very nice to meet you again here in Brussels. And I know that VHPB had some meeting on Belgium and Luxembourg topics regarding hepatitis. Can you share with the ELPA members what is the situation with these two quite wealthy countries?
Yeah, sure. We had a VHPB meeting 2 days ago on the situation in Belgium and Luxembourg. And as you said, you could expect from these countries that they are doing very well. So we were very, I would say, astonished somehow that there is still room for improvement in both of the countries in terms of elimination targets, in terms of therapy targets for patients. Just to give you some examples, for instance, we realized that hepatitis B carrier mothers are recommended to be screened during pregnancy, but clearly there is no evaluation at all. So we don't know whether we miss a certain target, we don't know whether we cover all these mothers, or whether there is still perinatal transmission in a country like Belgium or Luxembourg. So there is really there a very important recommendation to evaluate that recommendation. On the other hand, it's hard for a Minister of Health to take decisions on the number of patients to be treated if you don't know anything about that potential number, whether it is hepatitis B or hepatitis C. So there was a real signal to do sero-epidemiological studies on hepatitis B and C in a very good sample of the population to at least know where your potential patients are, how to better screen to identify these patients, and then of course also a request to the Minister of Health to offer the therapy in a much larger way, so not depending on a fibroscan or not depending on a certain stage of the disease, but really to a much larger population of patients.
If we want to reach elimination goal 2030.
Absolutely. So the whole aim is, of course, is to assist WHO in the whole verification process of these countries and to help them reach the different objectives of that elimination goal.
Thank you so much for this brief.
With pleasure.